Ibadan. The Oyo State capital holds some of the country's most respected orthopedic surgeons as the Nigerian Orthopedic Association held its 48th scientific conference. Experts seek to examine problems reshaping trauma care across Nigeria, especially musculoskeletal infections that are becoming harder to detect and far more complicated to treat. The Minister of Health, who was represented at the conference by the Chief Medical Director, University College Hospital, Professor Abiodun Otegbayo, laments the limited diagnostics facilities and escalating wave of antimicrobial resistance, which places Nigeria at a difficult intersection of treatment options.
The Federal Ministry of Health and Social Welfare views the NOA as a strategic partner. Together, we must strengthen orthopedic and trauma care within the framework of the renewable agenda and national surgical obstetric anesthesia and nursing plan. We will continue to support improved training, research, and policy initiatives that enable Nigerian surgeons to deliver world-class care.
Meanwhile, President of the Nigerian Orthopedic Association, Professor Sidney Ibianusi, underscores the importance of the conference and how it can help bridge noticeable gaps.
Part of the challenges we also face in the issue of the resources we use to practice our art. Because of the pressure of the economy, access to implants and instruments has been a problem. So with that, we are looking inwards, trying to see how we can develop some of these instruments and hardware locally. So the association is working seriously with the government agencies and other stakeholders toward developing the orthopedic implants and hardware.
In his lecture on trauma care, an orthopedic surgeon and former CMD of UCH, Professor Temitope Alonga, explains how the growing resistance to most established treatment forms of trauma has made the push towards molecular imaging necessary.
An open fracture is probably the commonest injury you see in most emergency departments regarding trauma. And many of them, when they discharge against medical advice, they go to quacks who have not taken pain to actually do what we call a preemptive swab. Before you start antibiotics, you take a swab of the wound, both on the skin and the deep swab, and then you isolate the organism before you start treating them. And so we do have a lot of challenge with non-compliance with laid down protocols. There are 11 steps in managing open fractures, and if you do not follow them appropriately, the patient will end up with chronic osteomyelitis, which is a debilitating infection and sometimes can lead to deformities.
As part of efforts to support the cause, the Oyo State government made a commitment towards providing and sustaining quality healthcare system in the state, expressing optimism that the outcome of the conference will further reshape the medical landscape in the state and the nation.